Hello, welcome to my presentation on healthcare terminology in action. This is what I've learned so far in healthcare terminology. So I've learned that the world of healthcare is a very exciting world. Through projects, readings, and assignments, this course has introduced me to the aspects of the medical field that I never considered, jobs that I never considered, opportunities that I never considered, scenarios that I've never considered. I evaluated medical errors in the field of healthcare, reviewed a medical scenario, and I was able to interview a real healthcare administrator. So in terms of medical errors, one of the largest prevalence of medical errors is medication errors. Approximately one-third of medical errors come from medication errors, and 78% of medical errors in the ICU are medication errors. The reason why there's so much error in the ICU is probably because most of the patients who are coming in are unconscious or in a bad state of mind, so they're not able to talk about what kind of allergic reactions or medication reactions they have. And so using clinical pharmacists who are medication experts could prevent this or at least ease the burden of this on the patient because they can say, hey, maybe that's not a good type of medicine for the patient. Also, educating the nursing staff on the proper way to give the medication or the proper medications to give would likely reduce the amount of medication errors as well. When I did my personal reflection, I was wanting to be a nurse, but I was been praying a lot, and I believe that I want to be an occupational therapist because I feel like that's where God's leading me. And one of the questions that I've had is, am I outgoing enough? Am I too shy to be an occupational therapist? But after working as a patient transporter at the hospital for a couple of years, I've kind of broken out of that shell, and I believe that I could be an occupational therapist. In terms of being able to make a decision without second guessing myself, could I do that? And I believe I could because my mom left to Texas for a couple months. And during that time, I was forced to make decisions by myself without the consultant of anybody else. And I feel like during that time, I grew and developed into a more independent person. And in terms of the medical scenario that I was given was a nurse was doing a bunch of overtime. Their relief was late, and so they were very tired. They ended up giving the patient an opioid, but never documented it. So when the nurse came in for the night shift, they gave them an opioid as well. The patient ended up having an overdose and went to cardiac arrest. Now the question is, should the nurse report it to the nurse manager and come clean that she messed up? At first, you would say maybe not if there's no problem involved. But when I think of the story of David and Bathsheba, David committed adultery with Bathsheba and ended up killing her husband Uriah in the field of battle. He tried to hide it, but God knows everything. As it says in Luke 8:17, all that is secret will eventually be brought into the open, and everything that is concealed will be brought into the light. David was eventually discovered for his sin, and he was punished accordingly. He was still redeemed, though. And so while it is difficult, maintaining integrity in the medical field is important. So when I interviewed the medical administrator, the healthcare administrator, his name is Corey, and he is one of my friends at the hospital. He gave me a lot of great information about the field of healthcare administration, and he said that mistakes are easy to happen. They're easy to make. He said that he made a mistake that day, but it wasn't a big mistake and it didn't affect anybody, so it wasn't that big of a deal. But he said to always double check yourself, and staying on top of the latest changes in healthcare keeps you from doing harm. When he's talking about the prevention versus the diagnostic codes, so he works in the surgery department where he schedules surgeries for patients to have GI problems to get that resolved, like colonoscopies, endoscopies, things like that. And he said the code for a colonoscopy is 45378. He said that code has to be paired with the prevention code for the billing to be processed accurately. A prevention code is the patient's going in to get checked up. If there's nothing wrong and it's just to prevent them from having any issues, and that's a prevention code, the insurance will pay for the their part of the surgery, everything will be fine. But if they do find a cancerous polyp, for example, then that prevention turns into a diagnostic code. And if that diagnostic code comes about, then there's a discrepancy in the billing, and the insurance won't pay for the procedure because it's not part of the contract, and the patient will end up having a whole bill. So Corey's job is to make sure that discrepancy doesn't happen and to fix any kind of situations and to communicate that to the patient so that the patient knows what they're getting into. It was a very informative interview. But in terms of being an asset, staying up to date with the latest trends in healthcare and always double checking my work will go a long way. Continuing education when necessary. Sometimes nurses or occupational therapists, if I want to be an occupational therapist, I'll have to do continuing education. So staying up to date with that and being productive and showing a willing attitude, a servant attitude, wanting to go the extra mile for somebody else and make their job a little bit easier, and communicating across the board to other healthcare professionals. And lastly, not being afraid to ask for help. Corey said that, there's no pride in it. Just ask for help. You don't need to know everything. It's a lot to learn, and you don't need to know everything. But tying it all together, there's a whole lot to learn in healthcare, and from medical errors in medications to errors in coding, professionals must stay on top of their game to perform their jobs accurately and safely. Thankfully, with the proper training, though, I believe that I can handle this field because God will empower you. Why? Because it's not about you. It's all about God. God doesn't call the equipped to do his will. He equips the called. So if you're called to do something, just believe that God will equip you to do that job. And I want to remember that, and I hope that you remember that too. And thank you so much for reviewing my presentation. This is my reference page. You have a good day.